Dawes was among those speaking at a press conference that the PNP called to express concern about a number of issues, including what's been happening at the Kingston Public Hospital, KPH. He joins us now. Dr. Dawes, afternoon. Thank you so much. Appreciate you talking to us. Hey,
good afternoon, and good afternoon to all the listeners.
Boy, the irony of the situation must strike you the way. I mean, you came in some measure to significant national attention, having been the head of the then Junior Doctors, I don't remember if they called it that then, Junior Doctors Association, Jamaica Medical Doctors Association, calling attention to mold crisis in operating theatres and impact on patient care under the then PNP administration. And here you are. Don't know what it says about us as a country that we seem to be trying to solve the same problems over and over.
We're a pothole patching country. It's 10 years ago, almost to the day, that we had to keep a press conference and highlight a lot of the deficiencies that were facing the doctors and patients, the staff in general. And here we are again. And a lot of the issues raised then 10 years ago are still relevant today.
You don't get frustrated at that?
It is frustrating, and I think that's part of the motivation why I decided to go into politics, because you realize that at different levels I've gone as far as senior medical officer, your hands are tied, because the policy decisions are what really make decide what where the money is spent and what are the priorities. And you have a situation where we're just not maintaining the plants, we're not cleaning the AC ducts, we're not servicing equipment, and we should have learned from Cornwall that an AC duct is a petri dish. It is a culture medium for mold, and if you have that situation brewing, then it's going to spread over time. You should know that if you don't maintain an AC unit, it's going to break down. And if you have an AC unit that is broken down in an environment that is humid, you're going to have your operating theaters being infested with mold. So now you have a situation where, they said a stitch in time saves 9. We missed several stitches. And it's just unfortunate that it is poor people who are suffering, because it's really poor people who can't afford to get any private care now, and they're the ones who are dying waiting for their cancers and their emergencies that are not severe emergencies.
I'm looking at the mold assessment report on KPH. The conclusion says it's essential that mold remediation, be carried out immediately to reduce airborne mold spores to acceptable levels. Increasing ventilation by opening windows, wow, that's low tech, will help improve indoor air quality. Additionally, regular monitoring of mold levels and indoor air quality should be done every 6 months at least after the mold remediation to ensure long-term mold control. The Ministry of Health, though, and the Minister have said, since this report came out, they have said that they're dealing with it. This is being addressed. So why are you raising it now?
Because there is being addressed and there's effectively addressing. So when Cornwall, when the issues at Cornwall came to light, firstly they were blaming the staff that they were faking it and their symptoms weren't real. Then they downplayed it and said it was restricted to only one area. Then when they tried to deal with it, experts told them to go in a particular direction. There was an overruling of those experts, and they brought in some Chinese robots to clean the vents. Now, when you have vents that are blocked up from the 1980s, and you have a robot stirring up all of that waste and residue that has been in the vents, it is going to just dig up a whole bunch of spores, and it allowed everything to spread through the hospital. Then you continue to take steps for years and billions of dollars later until you have reached a point now where the actual work of fixing, of building out Cornwall has only started 6 months ago.
Except I'm asking you about KPH, and you're gone off into Cornwall, so I don't focus on KPH. I tell you what, I do beg your pardon. Can you hold 1 second for me, Dr. Dawes? I'm at the break. Have to take the break. We're coming right back to you right after the break. We're talking to Alfred Dawes. Dr. Alfred Dawes is opposition spokesperson on health and wellness. We're back in a moment with him. All right. Thank you so much for staying with us. We continue with you now on Beyond the Headlines. I'm Dion Jackson-Milo. And we remind you of our WhatsApp line. It's 876-553-5908, 876 553-5908. Give us your first name, give us your general location. We're talking to opposition spokesperson on health and wellness, Dr. Alfred Dawes. He's been raising a number of concerns in relation to the health sector. We're talking about concerns about mold at the Kingston Public Hospital. Now, last week, Health Minister Dr. Christophe Dunn spoke on Radio Jamaica's hotline. He said the AC unit that had forced the closure of the problems with the AC unit have been fixed. It's because of the AC unit why the operating theatres had developed mold and had to be closed. He said mold remediation work is going on. He said the work that's being done is very thorough. There should be a better situation when that work is finished. And he also said the construction of a new plant at the hospital will fix these problems. I was asking Dr. Dawes just before the break, seeing that the ministry has said they acknowledge the mold problems. They said the remediation work that has been recommended is being done. So I'm asking him why raise this now, and he went off into Cornwall. And I was like, come back to KPH now. Why raise KPH now?
Well, I went off into Cornwall because we were told for 9 years that remediation is being done and it is being dealt with. And we were caught up where for 9 years, all of Western Jamaica, and by extension the island, because sometimes you have to send patients there, we suffered for it. And I just don't trust them because they are not giving us the true story. They always try to downplay the severity of these situations. And I can tell you for a fact, even though they say that the remediation work is going on and they have dealt with the clinic situation already, I'm challenging the Ministry of Health to release a second mold report that was done after they did their remediation work. I'm challenging them to it, since they say that they're speaking so confidently that work is taking place.
So you know of the second mold report?
I'm challenging them to release it.
But if you know of it, why not request it?
I'll just leave it at that.
I understand, but I mean, it's nice political theatrics, but why not just request a report, which you can do by law?
They're not going to give us. They're not going to.
You can do it by law.
They're not going to give this report.
Do it by law. Do it under the ATI Act if you know of the report. Make the request.
And you can do that as well.
No, and we're going to do it as soon as we come off here. I'm just saying, though, rather than just say this, release the report, you could actually take action to force a release.
It's easier for them to just release it since we've asked for it, rather than going through ATI. But the fact of the matter is that the situation is far worse than they're making it seem. They're making it seem as if it's almost business as usual, where surgeries have been outsourced to other hospitals and the clinics have been moved to another area. The fact of the matter is that ICU spaces have been downsized and they're over by Victoria Jubilee Hospital right now. The elective surgery lists have been cut back significantly because they are now shuttling patients to UA and National Chest Hospital and even Bustamante Hospital for children to have some of these cases done. There is a backlog of cancer cases that cannot be cleared because of the slow rate of operating, and there's an accumulation of new cancer patients in the clinics. Dire emergencies are being done. Less dire emergencies have to wait until they become sick enough to be considered dire emergencies. That is the situation that's taking place. When you transfer a patient to a type A hospital for critical care, they're supposed to go to ICU. Now, when you transfer a ventilated patient, they put them on the wards and change the breathing circuits because they have to accept them.
Sorry,
the staff are very. So
I'm not understanding the process you just explained. What's the problem?
So a type A hospital is supposed to accept the more complicated patients from the type C, type B hospitals all across Jamaica. Right, because they have all of the specialties and the support staff to effectively deal with those patients rather than a rural hospital with not many resources. But when you transfer the patient from those rural hospitals, those type Bs and type C hospitals, and you think that you're sending them to a tertiary care facility that is type A and has better resources, the patients are in many instances worse off because they're just put on the wards with regular patients. Now, the problem is that a lot of the doctors and the nurses, they are afraid to speak out because they're terrified of victimization. So I'll get examples of what is happening, and they're asking, please highlight this, because they're making it seem as if things are okay, and they're not okay. The staff are concerned about the care of their patients, and it is being made to seem like there's a mold problem, and we're dealing with it, and in the meantime, clinic is there, theaters are there. But they're not telling you that they have scaled down services significantly, and it is almost a horrifying repeat of what took place at Cornwall, because I saw this in my very own eyes when the mold infestation was discovered at Cornwall. It is the same playbook that they're using. They're using PR to downplay what is taking place and make it seem as if the system is working. And it's not.
All right, our initial request for comment today, we're told nobody was available for today, but the word we did get from the ministry is that this, what you're saying, it's incorrect, that in fact the issues are being addressed and the other hospitals do have the facilities to do emergency cases.
And this is exactly what I'm talking about, the PR response. Because you can say that the hospitals have the capacity. What that is saying is that theoretically they have the capacity. But the fact of the matter is that the doctors and nurses who are shuttling the patients to UA, to Boston, and to National Chest, they know that enough cases are not being done, and they're not getting through the list every day, and there's a backlog that is growing every week. The Ministry of Health needs to stop obfuscating and come clean and let people know what's happening. Because we are in a crisis mode. And they cannot build a strawman argument and force us to fight that strawman. We're going to constantly redirect public attention to the fact that services have been significantly scaled down, and KPH cannot function as a proper referral hospital for the rest of Jamaica.
What do you want to see happen?
They can speak about the university hospital, which a lot of patients who go there, they're sent back because they can't pay.
What do you want to see done? I mean, the ministry is saying mold remediation is taking place, work is being done to fix it, but what more are you asking for?
Stop the PR and gimmicks. It's as plain and simple as that. No. Come clean and let people know what is the level of service disruption. Let people understand that if they have cancer, they're going to take longer to get definitive treatment because there's no CT scan or MRI available. They're going to take longer to get surgeries. And if you are in an emergency, it is going to be more difficult for you to access care. It's as simple as that. Come clean. And if you can state clearly that what I am saying is not true, then I'm going to have to start asking some of the very doctors and nurses who are telling me the situation on the ground to come out and say it as well. Because it cannot continue like this. We saw it happen at Cornwall Regional, and we're not going to sit by and allow KPH to become Cornwall 2.0.
Yeah, I'm going to say again, though, before I let you go again, some of the information that you're getting, and I do understand, obviously, that you know healthcare professionals, they're speaking to you, they're passing on information, but again, some of the information you're sharing that you've got informally, you can ask for officially, and surely you think that would lend your comments and your statements more weight as opposed to you saying Ray and the Ministry of Health saying Ray.
Well,
that's where we are. You are saying X and the ministry is saying not so.
That is, and they did the same thing where Jesse James said that the water quality was poor. They came out and said no.
No, man, you're gone on to something else. I'm talking about.
I'm just showing you another example of why you cannot trust what the Ministry of Health says.
Except I'm speaking specifically about statements coming from the opposition.
But I'm looking at their track record, where they said Jesse was incorrect and he was bringing false information until Jesse provided the report from the NWC. And now the Ministry of Health has egg on its face in that instance.
Well, except the Water Commission has been saying that they
backtrack on that, by the way. But the report is there. That shows that.
Let me finish a sentence on Dr. Dawes, though. I was saying that the response when we were speaking about the report is that the report was reported the contamination was reported in terms of coliform, and that Councillor James was speaking about fecal coliforms, and the Water Commission was saying that's not accurate. That's not what the report was saying.
coliforms, he mentioned that coliforms are usually found in feces and soil, and he said that again today. But we digress. I was just looking at
no, what you're doing is ignoring the point I'm making.
The point I'm making is
we went through the report. I am simply saying that the Water Commission was saying the report was also nuanced in terms of how you read it, and that the way in which Councillor James was reading it was not entirely, was not complete based on how they report the information.
I have a problem if I am drinking water where it is 3 times the upper limit of normal, the allowable levels of bacteria in that water. Wouldn't you have a problem with that, Dan?
You keep dragging red herrings across the point I'm making.
No, it's not red herring. I'm asking you.
Actually, it's no man. My view on it is completely irrelevant. What I'm saying is that I'm merely suggesting
to form their own opinion if they're comfortable drinking water with 3 times the upper limit of normal level of bacteria in it.
And I'm sure they will. I'm merely saying, as I run out of time, that I think the public would be better served instead of a tit for tat with more substance behind the opposition's comments. That's all I'm saying.
Well, we can release whenever we can, but we have to protect the identities of our confidential informants.
No, man, I'm not suggesting you. I'm not suggesting you come forward and you say, nurse this, do this, and nurse that, do this. I'm saying, for instance, you know of a second report.
If you have listened to everything what the ministry has come out with, it is always these nebulous, vague, obfuscating rebuttals. Oh, there, the capacity is there. We can do this. It was the same thing with the ventilators.
Right.
They made it seem as if we were making, harebrained claims about the ventilators, and it turned out to be true. Right. We had less than half of the ventilators that were donated or purchased working.
I'm going to have to leave it there, Dr. Dawes. Always a pleasure talking to you. Always appreciate your time and your thoughts. Thank you so much.